to today's podcast on MedSynapse, where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host, Dr. Smarika Bhatt, and today we have privilege to talk to medical expert Dr. Thiagarajan Srinivasan. He's one of the India's foremost expert in liver transplantation and hepatobiliary surgeries. Dr. Thiagarajan brings over 13 years of experience in liver transplant and a remarkable record of more than 1,700 liver transplants. He currently serves as the Director of Institute of Liver Disease, Liver Transplant, Minimal Access, and HPV Surgery at MGM Healthcare, Chennai. He is the first surgeon in India to have done 40 hybrid small incision 3D laparoscopic surgeries and followed by robotic donor hepatectomy. Welcome, Dr. Thiagarajan, to the podcast. It's an honor to have you here.
Thank you for inviting me.
Thank you so much for joining in. So let's start with the first question. With your experience over 1,700 liver transplant, every surgery is representing life transformation. I'm curious, what would be the hidden pillars that have made your program so successful?
Good evening, viewers. I'd like to say for a successful liver transplant program, most importantly, it involves very careful planning, excellent coordination, a timely execution. The first and most recommended quality team, the transplant surgical team is the kingpin of the whole liver transplant team. And you need to have very highly experienced hepatobiliary and liver transplant surgeons, ably supported by the interventional gastroenterologists, nephrologists, cardiologists. So you need to have a highly qualified, full-fledged team, not only the clinical team, but also the highly qualified nurses, nutritionists, transplant coordinators, social workers, and you need to have a large gamut of nearly 100 people to have a successful transplant program. And when you have this multidisciplinary team, and you can have very good results. And not only the team is important, the infrastructure is very much important. Or you call it AI powered, imaging powered, and all these tests and diagnostic modalities. You should have the latest gadgets, so many gadgets in CT scan, MRIs, and surgical instruments, endoscopies. And you need to have all this to have a cutting edge technology to have a successful transplant program. And the psychological, social evaluations, the family support, and everything has to be done very meticulously. And also, you have to explain these patients what are the criteria for organ availability, whether it's a living donor, cadaver donor, and the access to the donor organs has to be explained to them. And the patients who are waiting for the transplant have to be carefully managed.
Team development is essential in such a complex field. How do you approach training and building expertise within your institute?
So the most important aspect of team development is you have to identify the correct set of people from the early stages, and it is important to train them properly over many years. And it's not only the junior surgeons have to be recruited and trained, and they have to be given adequate chances to do the procedures, but at the same time, you have to ensure the safety of the surgical procedure, and you have to instill the habit of trusting each other. That's the most important in the team development. You have to help each other in times of crisis, and you should not actually blame your team members if anything goes wrong, and you have to back them up very well. It goes in a long way in establishing a good cooperation between the team development, and not only the surgical team, the transplant coordinator team, the physiotherapists, the nutritionists, even the nurses, they have to be trained extremely well in liver transplant programs. And the patient counselors, the social support counselors, all of them have to be trained very well. And if you hold together a team for a very long period of time, it will result in a very good, successful program with excellent patient satisfaction. And more importantly, you have to invest and allocate adequate resources in the workforce expansion. You have to take care that the workforce is not overworked, and you have to have various quality measurement indicators that your team is not drained, because it's a long surgery and involves a lot of time. You have to have adequate that they are adequately rested, and most importantly, you have to have specific protocols, standardized protocols for the teams, so that everybody can adhere to these protocols and deliver outstanding results.
Okay, so success in liver transplant program goes beyond surgical outcomes. What benchmarks do you use to measure the overall success of your program?
So it's not only important that you have a excellent surgical outcome. At the same time, you have to have various quality measurement criteria. Simpler of these criteria would be to do bi-weekly audit, statistical meeting, and review meetings of mortality and morbidity regularly. And also, you have to adhere to the local, national, and international guidelines, and you have to have very high standards of care. And we are a part of this Indian Liver Transplant Registry, where every transplant is recorded and is well available to a external benchmark. And also, not only your team, your hospital has to have a good quality assurance program. For example, MGM Healthcare has a JCI accredited Joint Commissioner Internet accredited hospital, and also you have the NABH accreditation. So you have so many accreditation programs, you have to adhere to them. And by ensuring optimal outcomes, what you measure is also important. You have to, for example, you have to mention long-term patient satisfaction rates, mortality rates, morbidity rates, the infection rates, and you can have a simple feedback form for the patients. Each outgoing patient they can give you accurately how you are performing, improve the program according to the various types of feedbacks you receive. That's how we ensure we deliver a very high standard of care. It's not important about the quantity, it's always about the quality. If you insist on high standards and quality of care, evidently your program will be very successful.
Okay, so I want to wrap up the podcast with one last question. Access to advanced care remains a challenge for many. What strategies have you implemented to make liver transplant more accessible to economically disadvantaged people or patients?
Yeah, that's a most important question in our part of the country. That in, for example, in Western world, a transplant is very costly. It can cost in crores, but in India, it's already very subsidized. It costs between 20 to 25 lakh rupees. But even for this money, majority of patients are not affordable. And it's important that I would appeal to the government to have the insurance programs. For example, PMJ is the largest insurance program in the world, does not cover transplant programs. They should be able to cover. One good thing about the state which I am practicing, Tamil Nadu, has CMHIS, which is the Chief Minister's Health Insurance Scheme, which covers the transplant and 2 year post-transplant care completely. It's covered under the insurance program, and also it has a special insurance program for the government employees. And all those patients who couldn't enroll are not eligible for these insurance schemes. And we have tie-ups with corporates where we subsidize patients. The hospital also does its part to especially help the poor patients. By these various methodology, now I would confidently say money is no longer a problem for a transplant. We can almost deliver these excellent services to anybody who needs this.
Okay, thank you so much, Dr. Thiagarajan, for sharing your insights.
Thank you.
Thank you for joining us.
Thank you.
And thank you to our viewers for tuning in. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, or contribute to the ongoing evolution in healthcare. So until next time, stay healthy, take care.